In society, it is common to trust healthcare professionals as they care for the well-being of their patients, providing professional assistance. However, this is not always the case. Sometimes, people in white coats turn out to be killers. This is the story of the Angel of Death, a nurse who killed children. According to rough estimates, she took the lives of about 60 infants. Janine Jones was born in 1950 and grew up in a foster family. At 18, she married her first high school love, but the marriage was short-lived. 6 years after the wedding, the couple separated. Janine remained alone with a child. 3 years later, her husband returned, and their second child was born. However, this could not save their relationship, and Janine, not wanting to repeat past mistakes, started a romance with a 19-year-old. In terms of her professional life, Janine Jones trained as a cosmetologist and later obtained a nursing license. Her first job was at the Behar County Hospital, where she worked in the pediatric intensive care unit, marking the beginning of her murderous career. In the facility, infants began to die nearly 10 times more frequently. However, the symptoms varied: sudden cardiac arrest, bleeding, and more. Most often, this occurred between 3 p.m. and 11 p.m., leading the staff to nickname this time the death shift. Remarkably, one nurse suspected who the real culprit was and reported it to the hospital administration. However, the chief physician chose to simply dismiss the employee. The institution decided to change its hiring policy, allowing only individuals with diplomas to work there. Janine Jones not only got away with it but also received glowing recommendation letters. This helped her quickly find a new job and continue her killing spree. This time, she became a nurse at a pediatric clinic in Kerrville. With her arrival, young patients began to experience more suspicious seizures. Angel of Death was arrested after the death of a 15-month-old girl. Chelsea McClellan's parents brought her for routine vaccinations, but after the injection, the child had a seizure, and then her heart stopped. During the investigations, it was revealed that children became unwell precisely during Janine's shifts. Additionally, medication tampering was discovered. A dangerous drug was diluted with water. This allowed the nurse to conceal her theft. In questioning, the woman admitted that she administered injections to later resuscitate patients and received praise for her actions. However, her brilliant plan did not always work. There were too many victims, around 60 people. The exact number could not be determined due to a lack of conclusive evidence. For the death of little Chelsea, the nurse was sentenced to 99 years in prison. Later, an additional 60 years were added to this term for attempting to murder another child. The Angel of Death could have been released on parole, but in January 2020, she received a new life sentence for the murder of an 11-month-old boy.